Okay, good morning. So I'm going to do my presentation in full Spanish, so please bear with me because we're in Seville. So the idea here is to talk about the learning curve, right? And so I've been practicing the technique since 2020 when I learned with my dear friend Elsa Gonzalez, and I've been doing this in Madrid since 2021. So what we'll be talking about, hopefully in 8 minutes, learning curve, a tiered approach for UBE, implementing a practice in UBE, and of course giving you some tips in order to accelerate the learning curve. So the idea is for you to become from zero to hero, okay? So there is an investment cost of surgical mastery, my friends, and we have to recognize nowadays that UBE is not a fashion anymore. It's a global trend, okay? And you need an investment if you want to learn UBE. And there is this very nice graphic where we can see that you're going to have a cutoff of cases in order to have efficiency, and then another cutoff of cases when you're going to have safety. So you're going to achieve a speed long before you achieve safety because you're going to need a number of cases in order to reduce your complications. We do have literature about this, a number of cases that you need in order to achieve speed and efficiency and then mastery and patient safety. And there is this danger zone between when you're doing the things really fast and then when you're reducing your complications. How do we know this? Because we have some statistical tools in order to analyze learning curves, like for example the QSUM method and the risk-adjusted QSUM method. So of course the numbers are not the same for discectomy or decompression, as you can see here, and it's of course different with cervical and thoracic procedures. The numbers are different, the first cutoff, the full mastery, etc. And now I want you to learn about how can we approach the learning of UBE by a tiered approach. So the progression should be like in a stairway, okay? You should start doing lumbar cases. This is the foundation of the stairway. Then you can ascend to the cervical region, and finally to the peak of the summit, which is the thoracic region. And my friends, this is very important. Skipping steps could lead to complications. So you have to be very careful when you're doing your indications to your patients. Why this proposal? Because this is a difficulty progression based on number of cases, number of pathology, and complexity of the procedures. So I think there is no debate. It's a mild debate. We can discuss about this later. So this is the anatomy that we propose. We can talk about this, during the course, but I think that in the lumbar region, the most basic procedure is the lateral recess stenosis decompression. Now, of course, when we operate, we don't do just one procedure, right? We do a combination. We do decompression, we do disc herniation and whatnot. But if you want to, separate all the procedures, you should start with the lumbar region, with this part, then cervical, then thoracic. And why? Because we're talking not only about number of cases, but also milestones. When you achieve some of these milestones, you can progress, you can advance to the next level. For example, if you want to do bilateral decompression, which is the tier 3, you should be able to triangulate, to mobilize the nerve root, to see the lateral border of nerve root, etc. And I want to introduce something, a very personal project of mine. It's called Focus. I hope it gets published this year or maybe the next one. And it's about how you can establish your practice in UBE. Okay, it's about philosophy and techniques of the beyond the technique. Okay, so there is a promise in UBE and reality. The promise is that you have enhanced visualization, but it's not that simple. You have minimal disruption, but you have to have a learning curve. There is efficiency and elegancy, of course, but this have to be a cognitive shift. And we're going to talk about the 5 pillars of focus, which are F, facilitator, O, operational mastery, C, competence with tools, U, unified towards the top, and S, sharing experience. So this is a very hot take because we have learned everything like this, right? See one, do one, teach one. This is not the case anymore, okay? Nowadays, competence-based training with calibrated autonomy should be the goal because you are the learner and you have to have exposure, preparation, practice, and execution so you can be involved in your learning process. So this is not an extrapolation, my friends. We have to have a cognitive shift. We have to develop an endoscopic thinking. It's not just applying what you already know from open surgery to endoscopic surgery. So as I said, do not confuse speed with safety because you're going to be comfortable with the technique even before you reduce your complications. This is very important also, knowing your instruments, as Dr. Gonzalez said before. Okay, this is the C, competence with tools. This is the U for a reproducible environment. If you have the same setup for every surgery, everybody around you will suffer less your nurses, your patients, your technicians, etc., right? And finally, and this is very important, sharing the experience, because in that way we can build a community. You're going to know today very nice surgeons, very influential people, with lots of things in social media, but there is a trap, okay? And the trap is that when I post a video, everything is so nice, right? I'm hiding my learning curve. The video and the data should be used objectively to self-correct, not social validation. But this is so hard because all of us have an ego, right? And just to finish, what's your first ideal case? This one should be your first ideal case. And this is very important, okay? One case in the morning, not two, not three. Previous training, get a mentor, my friends, a friend of yours that can assist you during the first surgeries. And if you want to succeed, you have to respect the technique. So take-home messages. UBE is a very versatile and reproductive technique. Training must be a stage. There is a difficulty progression. Don't complicate yourself. Start with easy cases, please. Standardize your technique. Respect the technique. This is very important. And, of course, invest your active time in learning from others, as in this course, for example. And this is very critical. You have to change the mindset in order to succeed in UBE. And that's it. Thank you so much.